Today we're going to be talking about data submission, which we call the harvest. And we're going to be talking about data quality report and just kind of dive deep into this so that people have a better understanding of how to do this. So our objectives, we're going to identify what a harvest is. We're going to know how to do a harvest, and we're going to be able to verbalize our resources for cleaning up our data prior to submission. Okay, so harvest is kind of a funny term. I know when I first started with this, I'm like, what does that mean? What are they talking about, the harvest? But basically, it's a term that we use for data submission. Okay, so when you hear the word harvest, it's the data submission. So right now, we're gonna talk about how many harvests that adult has per year, when the harvest due dates are, which harvests are star rating harvest, how you opt out of a harvest, and how to do a harvest. So we'll just get going on that. So when you go to the STS website, under the For Data Manager section, and you scroll down about halfway, you will see that there is a heading for harvest deadlines. And this is our 2025 harvest. So I thought we'd just break this down a little bit. So the word term identifies which harvest. So 1, 2, 3, or 4. We have 4 harvests per year. The harvest submission window close is basically your due date, okay? So it tells you when the information is due. The important thing to remember here is that the submission closes at 11:59 Eastern Standard Time on that date. So if you don't live in Eastern Standard Time, you need to have the time for your time zone as to when it ends. And I know for me, living in Pacific Standard Time, it would actually close at 8:59 Eastern Standard, 8:59 Pacific Standard Time. So keep that in mind. It's 11:59 Eastern Standard Time. The next column is the opt-out date. So this is the last date that you can actually opt out of the submission. The includes procedures performed through. These are identifies the surgery dates of the procedures that need to be submitted. So you're going to be including procedures, for example, in Harvest 1 through 12/31/24. The report posting gives you an idea of when your national report is going to be coming out. And the comment section identifies which harvest is a star rating. So when you look at this deadline, at the bottom here, it says data submission is open as continuous for all harvest terms. So what does that really mean, right? What does that mean? What does continuous data mean? So that means that basically you can submit data anytime until the harvest due date and time, okay? So remember, it closes 11:59 Eastern Standard Time on the date listed. However, if you've got to change something, it's before that date and time, you can go ahead, update your record, and submit it, and it'll be contained into the harvest. In the old days, we didn't have continuous harvest. We had a very short 2, maybe 3-week period where we could harvest. And it was very difficult, I think, to get everything done in that very strict time period. So the advantages of a continuous open data submission or a harvest is you can submit when it's convenient for you. It's easier to work around your work schedule, your vacation, your holidays. You could submit earlier, more frequently. You're going to kind of avoid some last minute problems or surprises, good feedback, early feedback, and you can submit smaller batches of data. So you can focus on, like, you might want to clean up a month at a time, and so you could focus on that. So I think it's a great advantage that we allow this to happen. And it's been this way for quite some time, but I remember in the old days it wasn't like this. And we were so happy when this started that it was such a great relief to us. So, what does it mean to opt out? So basically, if you decide to opt out, you're telling the data warehouse not to use your data for this submission or harvest period. All the data submitted during this submission window will be dropped. Analysis is going to revert to what it was at the last submission that you submitted. And so by opting out, the site acknowledges that they will not be included in analysis and will not receive risk-adjusted results for the harvest period. If it's a star rating period, you're not going to, if you opt out, you're not going to receive a star rating. So, why would you choose to opt out? Why does a site even choose this? I think the main reason for a site choosing to opt out is because the data in the system doesn't reflect their site. This may be because they realize they've been entering something incorrectly, or they're very far behind and they've got so much data that has not been entered yet. So I think those are probably the most common reasons why people opt out. If you choose to opt out, then there's a couple of ways you can get to the opt-out form. Okay, so on the STS Adult Cardiac Surgery website, under the For Data Manager section, you can see under the harvest deadlines here, if you click into that, there will be a link to get to the harvest opt-out form. You can also get to the harvest opt-out form in the IQVIA page. Okay. So there's two ways to get to that. I think the important thing to remember is that on behalf of the participant ID listed above, I'm electing to opt out of this harvest period. By opting out, I acknowledge that the participant ID listed will not be included in the data analysis and will not receive risk-adjusted results for the harvest period. Okay, so it's important to understand what that means when you do it. All right, so now that we know what a harvest is and what the deadlines are and how to find those things, now let's talk about how we actually do it. I like this little cartoon. Sometimes I like to treat myself at work and just do one thing at a time. Well, gosh, that would be nice, wouldn't it? But when we're talking about the harvest, there's lots of things to do. I think the first thing is to educate yourself on how to do one. Okay, so we're going to talk about the videos that will help you with that. You also need to collaborate with your vendor, so to know how to create the harvest upload file, because each vendor has a different process as to how they do that. So you need to know how that file is created if you're working with the vendor. You also need to make sure that your harvest file includes all the necessary information on each case submitted. So you have to have a participant ID, a surgeon NPI, a hospital NPI, and if you're in the anesthesia module, then you need to have the primary anesthesiologist NPI. Next, you've got to clean up your data quality report or your DQR and your missing variable report, and you have to get all this done before 11:59 Eastern Standard Time on the date of harvest close. So we do have some how-to videos. This is under the Data Manager tab, For Data Manager tab. You can see that IQVIA has an uploader and data quality review video. I've watched it. It's actually quite informative. They also have a couple of other really good videos here too, just for general navigation of the dashboard and your risk-adjusted report. In addition, so how you can also get into IQVIA. There's a lot of IQVIA resources. So when you actually get into their library, they've got an end of the harvest review checklist that some people might find helpful. We have the errors and warnings, which we're going to talk about later. The missing variable report list updates. You've got your missing variable report overview, uploader instruction, harvest summary, report overview. So there's lots of resources in the IQVIA library that I think I actually found them quite helpful when I was working on this presentation. Because, you know, when you think you know something, you don't always really know it. So I had to look all this stuff up to make sure I was getting everything accurate. And these resources I found very helpful. Okay. And we also have this video that I've provided the link for. This was done in February of 2024, so we probably need to update it. But Carol did this, and I thought it was a really good review of reviewing your data and cleaning it up. So I provided the link for you. It's on our YouTube channel. All right. So let's talk a little bit about the harvest upload file. So again, if you work with a vendor, collaborate with them as to how to generate that file so that you can upload that to the IQVIA platform. However, if you do direct data entry in IQVIA, the record will be included in the submission analysis once the record is marked complete and saved in the direct data entry form. Okay, so I wanted to point out there's two different ways that information get in. So I think a lot of people have vendors, so you need to know how to upload that file to the IQVIA platform. What,
Melinda,
Paul?
yeah,
Yeah.
sorry. Can I just jump in? It's actually the complete flag is not checked. The data for direct data entry people, when you enter your records,
Mm-hmm.
it's considered for analysis. If it's not complete, maybe the patient's still in the hospital, maybe you only have half the data entered or something. We figure that out in analysis, but the complete flag is ignored.
Oh,
It's not
really?
used. Yeah, it's the records are considered for analysis regardless of the complete flag.
So how do you do that then?
That got changed some time ago. Yeah, if there's enough data there, we have the surgery date and the discharge date and the status, and
Mm-hmm.
if the data is there so that it can be used for analysis, it is.
Okay.
If the important information is missing, it's not.
Okay. All right. Good. Thank you. We need to
Sure.
update. We need to update that little information in the.
Yeah, that was changed a little while ago.
Okay. Thank you so much for interjecting that, Paul.
Sure.
Okay, so let's talk about what the necessary information, as Paul was just mentioning. So you got to have a participant ID. You got to have a surgeon NPI number. You have to have a hospital NPI number. And again, if you're in the anesthesia module, you got to have your primary anesthesiology NPI number, because if you have a missing surgeon NPI, hospital or anesthesia NPI number, or your participant ID is not there or doesn't match, these things don't match what you've submitted, then your record can be rejected. Okay, and these are considered critical errors, which we're going to talk a little bit later about the different types of errors that you get when you submit your information. So what are all these numbers? So, well, your participant ID, remember, we talked about this in a prior webinar, is that unique 5-digit number assigned to each STS participant in the database. Okay. If the entire surgeon group changes, then, if you have a new contract, then of course you're going to get a new participant ID number. So their national provider ID, this is usually what you would call a hospital NPI number. Okay, so sometimes you might, if you're in a big hospital system, there might be multiple NPI numbers for like different hospitals that are in that system, or there could be just one. So make sure you know what at your site, what the hospital NPI numbers for your site. Um, the national provider or the NPI number, there is a number for providers. So like the surgeon has an NPI number, okay? Each surgeon should have their own NPI number to identify them. And then, um, so understand what these different numbers are. Paul, do you have anything else to add about these numbers that would help clarify that?
Now they are very important. The main thing is that in most cases, like for your participant ID and well, mainly your participant ID, that is entered by your vendor software. So you actually may not even have control over that one. Um, and then the surgeon NPI, even hospital NPI and stuff like that, that is going to be tied into within your vendor software. There should be something where you put in the surgeon's name, his full name, or and the associated NPI number. And then when you're doing your data entry, you just select it from that list that you created. So when you're making sure that it's correct, you're going to do that on some like administrative level for like all of your data to make sure you have the right NPI for the surgeon. Um, and then as far as each individual record is concerned, you just make sure that you have that value filled in with one of those values.
Thanks, Paul. Thank you.
Mhm.
Okay, so we're going to move on through here. Oh, I gotta get back to the right page. Okay, so I want to point out this general overview of the STS IQVIA uploader. It actually has a lot of really good information in it. I'm not going to go over everything that's in it. It's in the IQVIA library. The video that I showed you also speaks to a lot of this information. But as you can see, the table of contents is pretty detailed. And hopefully most of your questions would be answered from this uploader guide. So this is kind of what it looks like when you get in there. You can choose your file from your computer. Again, that's why you need to know how to create the file from your gender software. And you can either drag or drop it or upload it into here. Once you do that, you're going to get an uploader history report, basically. It's going to tell you a number of the count of records that were processed. And you can see, it's got your facility number, your file upload completed, a name of the file, and whoever uploaded it, okay? And as we move further into this, it's got a lot of little things I think that's kind of interesting. So success is a green check mark, okay? So green is good. Failure, red, bad. That means you've got some sort of critical error that's preventing this data from being uploaded. Again, you have your date and time that you actually uploaded it. This is the upload ID. That's kind of an automatic number that's signed. Your facility, your processing status, the name on the file, and whoever uploaded the file. And you can see here, you were able to get this passed. You got a little X over here, probably because you've got some warnings, right? But you're able to view your reports, and 25 out of 25 records were uploaded. So let's talk about the types of errors, and then we're going to talk about the resource that's available to help you identify what those errors mean. So you've got your critical errors, that's the red. Okay, so critical error is basically you have to fix those errors or the information's not going to be entered into the warehouse. Okay, so you can see an example down here, 0 of 28. So there were 0 records of these 28 records that you tried to submit, and there's a critical error. You got the red arrow there. So then you have errors. These are like, it's the little yellow identifier. Okay. And then you have your warning symbol too. So we're going to talk about the different kinds of errors and give you an example of how to find out what they mean, where to find it. So in the IQVIA library, they have an errors and warning updated. So this is the document that shows you what types of errors. So for example, we're going to look at the critical error. So when I pulled this document up, this is a screenshot of the critical error. And you can see that it gives you the variable field name here and the message. So this says admit date. Admit date must not be after hospital discharge date. So that's a critical error. You're not going to be able to move until you fix that. And so this is a list of, you get a list of the entire critical errors. So it helps you identify what the real issue is with the error. I think it's a great resource. The next tab in this spreadsheet that you pull up, the errors and warning spreadsheet, talks about the errors. Now, in the old days, we call these consistency errors because this is stuff like renal failure dialysis is yes, but this conflicts with post-op renal failure being marked yes. So it's kind of like, it doesn't make sense. There's a little inconsistency going on. These errors, I suggest you try to get them fixed if you can. Sometimes you can't always do that. Like it may be like trying to think of an example of, used to have one in the old days where if you're had a history of an AMI, but you put unstable angina as the CAD presentation, then it flagged you. So, but usually these things can be fixed and you want to get them fixed. The third type of error are the warning errors. And I just like, are you sure? Are you sure this is really what you want to enter? And again, a lot of these are outside the usual range, or most of these are range, really. There's a whole slew of them. And you can easily, when you're going through your data quality report, identify these. This is like, honestly, the last thing I look at. I look at the criticals, and then I look at the consistency, and then I look at all my mortality. And then if I have time, I go look at these warnings, because most of the time I've already identified this as I'm entering the data, because you're going to get that little "are you sure" warning when you're entering your data into your vendor. So I've usually checked most of these. I feel pretty good about my information that was entered, because as I was entered into the form, I was getting a cue to check it. But those are the 3 types of warnings that you see. So you got critical errors, you have errors, and you have warnings. Okay. So after you've completed your data upload, now we're going to move on to cleanup and kind of go through the process of how we're going to clean this up. So what is the difference between the data quality report, DQR, and the harvest summary report? Okay, so I had to ask this question because I kept thinking, I don't really exactly know what the difference is between these 2 things. So they're essentially the same with one exception. Okay, the difference is that if you have a critical error when you submit your data, you won't be able to run the harvest summary report, because the critical error will prevent the data from being uploaded to the harvest summary report. So The harvest summary report only shows errors and warnings. It doesn't show critical errors. So that's the main difference. So if you have a critical error, then you would view your reports here directly into the data quality report to fix those errors. Once you get all your critical errors fixed, then you can run the harvest summary report and work from there if you like. I mean, you really can work from both of these. I guess it's just preference as to which one you want to work from. But if you have a critical error, you have to go into this data quality report. Fix that first before you can even run the harvest summary report. And you can see here, this is your validation alert summary. And you've got these errors in red. These are your critical errors. They have to be fixed before you can process. And then the rest of them you can see are warnings. Okay. And this is a fairly interactive tool. So you can click into that. It's going to give you the information of the case and the error. And if you're unsure what that error means or that error code means, you can reference back to that spreadsheet that we just reviewed about exactly what that error means to you. And hopefully that'll give you an idea of how to fix that error. But again, if you've got no critical errors, then you can view your DQR or your harvest summary using one of two methods. So again, like I said, you can go right here and view all your reports, or you can go into your harvest summary report because this will be generated once you have fixed all your critical errors. So preference, however you want to do it. There's two ways to do it. So the data quality report is what it looks like. Most of you, I'm sure, have seen this. Here's your file-based issues over here. It tells you you've passed. Then you've got your alert summary. You can see that you've got a very small proportion of errors here, lots of warnings, and it will give you the alerts by your records so that you can actually drill down into these records and fix the issues. It's a nice little drill down once you open it up. You can also export this data quality report if you want to work in it in a separate file. You can export it to Excel. So you can either do it up here at the top, export it this way, or you can also export and maximize the visualization by right-clicking on your report. So if you just click on the report, it'll give you the option to export it. So when you're in the data quality report, if you maximize the visualization, you can see all the selected rows, and there's navigation tools up here that'll assist you in going back, forward, reducing the expanse. But you can kind of see, and you can see the validation status. So there's errors, there's warnings, and again, critical errors first, then your errors, then your warnings. Or at least that's how I do it. Kind of break it down a little bit. I want to get, I'm trying to focus on the most important things first. If you want to view the data collection form, you can click on the access case link. So like you have brought up, let's say you brought your errors, your warnings up here, and you can see down here the patient source, and this is how you can access the case. Okay, so you can actually see what the issue is. Now, direct data entry users will be able to update and save the record directly from this port right here when they get into the record. Okay. However, if you use a vendor, then you have a read-only view. So you can look at it, you can see what the error is, and then you have to go into your vendor software, fix the issue, and then re-upload the file. Okay, you can't just fix it directly from here. But you do have the ability to see what the issue is if you're a little confused as to exactly what's going on. So the harvest summary report components is much like the DQR. That's why I had to ask the question, what's the difference, right? Because when you look at them, they're very similar. Again, you get the harvest summary report. This can be generated after you fixed all of your critical errors. And it's only going to show errors or consistency errors and outstanding warnings. Okay. And again, you've got your record ID, you've got the warning, you've got errors listed out here. You're able to drill down and identify what the issue is with each record. You have a date range on this of the data that you submitted. You also have a total number of records that was submitted in this date range. And again, we have the graph. It's an interactive graph. You can click on it. Things will open up. We'll be able to drill down and see what the issues are. Record level validation occurs here too. Again, you can actually get into the record, see the record, but if you're a direct data entry, you can actually fix it and save it and update it all at the same time. If you're a vendor software person, it's read-only. You can see it, you can identify the issue, but you need to go and update it in your vendor software and then resubmit that record. Alert counts. The thing I thought was interesting here is that you have this column over here, no validations outstanding. Well, the count of 1 will always display for records that have no validations outstanding. So don't let this confuse you, because I was like, what does that mean? 1, it says no outstanding validations. Well, it's just what happens. So this number is always 1. So you can see this record right here, this first one, number 3. There's no warnings at all, and they've got a number of 1 for no outstanding validation. That means this record is clean. It's clean. As opposed to the first one up here, you'll see there's 2 warnings, and the no outstanding validation is blank. It's missing. So that means this record isn't entirely clean. There's a couple warnings here. If it was entirely clean, you just see the 1 over here. And then I think, that's pretty much it for your data quality report, your harvest summary report. I think the other next place I would probably go is the community page. Some people probably go here first. I think it's all a preference of how your process for cleaning your data up is. There's no really tried and true process. It's whatever works the best for you and how you flow your work. So on the community page, this is I think an extremely helpful tool. You can see that you have your mortality analysis. And as we talk through this, the mortality analysis includes the following variables. So status at hospital discharge, status at 30 days, and operative mortality. And you can see that we have missing for the isolated cab. Let's just start with the first column here. 2021, there's 0 missing. You had 146. So your percent missing is green. Now remember, green is good. Okay, good to go. sort of like a stoplight. Green is good. But you come down here to 2023 and you've got 4 missing mortalities under your cap out of 212 patients. And your number is 1.89, yellow. Okay, so yellow is kind of like, oh, slow down. Look at this. You need to work on this a little bit because you must have less than 2%. Okay. If you have 2, it's not going to work. Less than 2%. And that means missing or unknown. Okay, so if you code unknown for a mortality in your database, that's just like leaving it missing. And it needs to either be a yes or a no. And it's each calendar year. You can see how this is divided out into each calendar year. So you do not want more than 2%, 2% or more in any one of these calendar years, or you can risk not receiving a star rating. Okay, so this is super important. And it goes through other different categories. It's an easy way for you to identify the things that you need to fix for the mortality. As we scroll through the community page, I love this page. I think it's just got so much really good information in it. When you get down here, it talks about outcome and process measure analysis. Now, I want you to look at this. This is just for isolated cabs, okay? And it's got the years here, and it's got the missing, and it's got your eligible procedures, and of course your percent. So what does this mean? What is this trying to tell us? So participants will be excluded from analysis if they had more than 5% missing data on any of the following process measures: IMA usage, preoperative beta blocker, discharge beta blocker, discharge antiplatelet, and discharge antilytic. Okay, so you also are at risk from not getting a star rating or risk from not being in analysis if you have more than 5% missing for your isolated cab for these particular pieces of information. This is a quick way for you to identify it and correct that information if you're at 5 or over. And again, I just want to bring out the minimum data thresholds about the procedure ID. So Nancy made this graph for a webinar recently, and I thought it was fabulous. Just kind of a quick way. Cabbage is 50. AVR plus cab is 10. MVRR is 36. MVRR plus cab 25. The multi-valve plus cab, there's no minimum thresholds. And the multi-procedure is 100 across all the procedure IDs. So I think that's kind of really good information for you guys to have.
Hey, Melinda, it's Carol. Can I just jump in real quick on this page while you're going through it?
Yes, please.
So I just wanted to add a couple things, and I'll touch more on this on my presentation. I think it's on April 8th, Nancy told me. The year column represents the current harvest that we're abstracting in. So the screen that Melinda has on right now, where it shows 21, 22, and 23, that's going to be for harvest. That looks like it's the full year of 21, the full year of 22, and the full year of 23. That will be, was likely taken for Harvest 1 2024. This screenshot was likely taken for Harvest 1 2024. That time frame ends December 31st, 23. When the harvest closes, these dates on here get updated to that next current harvest that we're abstracting. So you would have, so that next harvest that would have been abstracted following Harvest 1 of 24 which includes the calendar year end data for 23, would include the first 3 months of 24, January, February, the first 3 months of 24, January, February, and March. So you would see an extra row added on here for 24, and then the 21 would be the 9 months of 2021, 12 months of 2022, 12 months of 2023, and 3 months of 2024 to make up the 36 months in analysis. That change in dates happens shortly after the harvest closes. So shortly after harvest 1 of 24 closed, these dates would have switched over to the next harvest dates. So it's current with the harvest you're abstracting. It's just there's just a little bit of lag time from when the harvest closes to when this year row gets updated with the current dates. The other thing I wanted to point out is on this minimum data threshold by procedure, the multi-valve and multi-cabbage is not a composite measure. Because of the low number of cases that go into that, that are performed, that are considered multi-valve cases, we don't have a star rating, and we refer to star ratings simultaneous. I guess we use the same name. Composite rating and star rating equals the same thing. So multi-valve plus cabbage does not have a star rating or is not considered a composite rating. And because of the low end, there is no minimum case count requirements for that. So I just wanted to clarify those two things on this page. I don't know if multi-valve has been added to this community page for the missingness for the, but if it has, I have to clarify the language on there because it's not a composite rating. So I just want to make sure I called that out. Thanks, Melinda. Sorry for interrupting.
No, thank you. Thank you. It's I'm not even sure if multi-procedure's been added yet myself, but I just liked this graph and
Yeah,
I
it's
thought this
super
was
helpful.
useful, helpful information. So, and I think we talked about, yeah, we're going to talk about star ratings a little more in the next session. That's where we're getting into star ratings. But thank you so much for adding that, Carol. It's very, very good information because I do get a lot of questions about, well, when does this update? You know, when does the community page update? And when do the dates change and all? So that's very good information.
Yeah, the reason it's super important is because, for example, Harvest 1 closed in February. I think it was February 19th, if I remember correctly. And Harvest 1 includes surgery through December 31st. If we're looking at Harvest 1 of 25, that include data through December 31st of 2024. As you're entering in, and say you get all your cases entered in, and you're one of those abstractors who likes to, you're a real-time data abstractor. So in January, you're entering your January cases in, but because we're still technically abstracting for the Harvest 1, you're not going to see your January cases on here until that current harvest closes. So you may be abstracting, you may have been abstracting the January first 2 weeks of February cases, not seeing them populate on the community page for this widget, but that's because this widget is still focused on the harvest that you're cleaning up for, preparing for harvest close. So that's why that's why I thought that was important. And we do get a lot of questions, Melinda, you do, and I think we get them here too on both ends.
Yeah, that's a great point.
Yeah.
Very good point. Thank you.
Thank you.
Okay, so the last thing is the color code. Now remember, green's good to go. Yellow's slow down. Wait a minute. I better look at this more. And red, oh, red means stop. You got to get that fixed. Because if you're in the red here, in one of these columns, you want to get that fixed because remember, could affect your star ratings. Okay, so this is also really, really, really important. I'm going to bring this up. I don't think we focus on this enough. We also have a column on the community page for a number of cases still in the hospital for all the years during the time frame for this community page view. Please check that. I mean, I know that some patients may stay in the hospital for 8 months to a year, but we've seen patients that have been in the hospital for 3 years. Okay. And that's, maybe it happens, but it's probably really unusual. So make sure that you're checking this too and cleaning those cases up that you probably forgot to go back and take them out of the acute care setting. You just forgot to go back and fix that. Because remember, cases that are still in the hospital are not analyzed. So that data from those cases that are still in the hospital don't get analyzed. So if you've got patients that really have been discharged, you would want that information in your site and that data analyzed. So I had to bring that up. Okay, so missing variable report. This is another piece to the cleanup of your data. Again, you find this in IQVIA under your operational reports. There's a missing variable report. This is just basically going to get you focused on the things that you've left missing. There's a really nice guide for the missing variable report overview. It's also in the IQVIA library. It has lots of great information in it. When you actually go to run your missing variable summary, you can put a date range in here. And then a report is going to be generated. It's going to look a lot like this. And you can see that it's telling you the version, the surgery date, the short name, the name, the percent missing, and basically how many records. So you can easily identify. And some of this stuff, like, there's some sites that never do intra-op hemoglobins. So you always know those are missing. So, just don't waste time focusing on things that that's always missing. I kind of scan over this. I look for things that, well, why would that be missing? That's never missing, kind of things like that. But some of this stuff you're going to easily be able to identify as, oh, that's always missing, or we don't do this, so it's never there. But when you look at this column, again, you've got short name, you got the full name, you got the percent missing, and the number of records that this particular piece of information is missing from. You can also filter through this report, which I think is kind of nice. You can do the risk adjustment models, the process and outcome measures, the PROC IDs. You can kind of filter and play with this a little bit. And that guide goes over exactly how to do all this stuff. Most of you probably already know how to do this, probably better than I do. You can also drill down in this report by clicking. Like if you've got 8 here, 8% missing, that's kind of a lot. Seems like a lot. So you can click into here, hit this 7/91, and you're going to it will bring up the records for you that have missing INRs. And again, if you are a direct data entry person, you can go right into the form and fix it and update it. If you have a vendor, you can view what the issue is, but then you need to go into your vendor software, update the case, resubmit the information. There's kind of a lot of interaction that you can do with this report. You can open it in new windows. You can completely focus on missing this. I mean, it's kind of an interesting little report to interact with. You can even generate an entire list for all your missing variables, just simply by right-clicking and highlighting the columns that you want, and it will generate a report. So lots of little tidbits of information in the IQVIA documents in the library. There's a lot of really good information in that library. You can even export this. So there's options to export it so that you can view it as an exported document into Excel if you like, or PDF, however you would choose to view it. So that's basically the end of this particular session. I know it's a little shorter than some of the others. We will entertain questions. The next session is next Tuesday, March the 25th at 12 Central Time. We are going to be talking about the National Report Overview, star ratings, process and outcome measures, and kind of diving deep into that. So thank you for listening, and we'll do questions now.
Thanks, Melinda. That was wonderful.
Thank you.
Lots of great information today. We will get to our questions here. So Mary has a couple of questions, FAQ type questions that we can go ahead and answer. So around illicit drug use, are opiate use plans included in this variable?
I don't know what she means unless she's
Yeah.
talking about prescribed opiates. I mean, if it's prescribed, it's not illicit, Mary. I mean, if your physician or providers prescribed you to take that medication, then it's not illicit. I don't
Right.
really know what that means, Mary.
Yeah, I think that might be what she's talking about. Regarding cath results, once diseased, always diseased. If there's 3 vessel disease, but there's a stent that says 0%, what do you recommend I enter for percent disease, or do I just leave it blank?
I think, Mary, you're talking about two different things. You're talking about 1170, which is the number of disease vessels. So that's once disease, always disease. So if you got a stent in a vessel, that means at one point it was disease. So that's 1170. But when you get down to the grid for the percentage of stenosis at the time prior to surgery, then if the stent has 0% in it, then it's less than 50. So you would just code it as less than 50%.
Okay. And then around the COVID question, are self-positive tests considered acceptable?
Yes, we have language in the training manual about that, Mary.
All right. Thanks, Melinda.
Mm.
If you opt out for a harvest, in order to get a star rating in a later harvest, would you have to submit that data? Yes, you have to have all of the data submitted within the 36-month period. And you would get a star rating for the current harvest that you're submitting for.
So, Nancy?
Do you want to add, Carol?
Yeah, I just want to double check on that because it means that if a site opts out and they don't submit cases for a quarter, that they would be without a star rating for 3 years, potentially. I just want to double check with Hannah on that.
But if they go back and enter their data,
Let's double check. Let's take it
let's
off.
double check.
I would agree with that. I would say if you opt out one harvest, but for the next harvest, you get the data contributed. I think each harvest is handled individually. We take a look at what's in the database on the last day of the harvest. And if you have data in there, you're in.
Yeah,
so,
there's I think they implement, let's take it offline because they implemented some submission requirements for going back for a few months if no new cases are submitted.
right,
But we had sites that had to opt out due to cyber attacks.
right.
And so we don't want those sites to go without, they don't have the staffing to go back and enter in 3 months worth of data. I mean, they would have to do it all. It's a mess. They would have to do it
Right.
all manually. So I want to just take it back and make sure, check with our analytics team before we provide an answer.
Okay. All right, well, we'll come back to that one when we find out more
Sorry.
information.
Thank you.
Thanks, Carol.
Yeah.
Are the thresholds across the harvest period in total for each year? For example, if we have a total of 52 cabbage procedures for the time frame, but less in each year, will we still get a star rating? So the minimum data thresholds are for the 36-month period or the 36-month analytic window. The percent missingness is by year. But keep in mind that for the harvest periods that have less than a year's worth of data in one of the years, it will be for the number of months that are in the year for that harvest. I hope that wasn't confusing. So Mary is asking if an isolated cabbage procedure was done in December of 2024, but is still admitted until the harvest deadline, do I still need to submit the data? Recently, I observed if sequence 7005 was yes, the procedure ID changed to other. So if you have, go ahead,
Go ahead.
Melinda.
No,
No,
I was gonna say if you have marked 7005 and the patient's still in the acute care setting, then that record will not be analyzed. But when the patient goes home, gets discharged from acute care, then you would go and update that record to say the patient's not still in the hospital. And at that point, once you submit it, it would be analyzed once you've completed the record. Nancy, anything else?
no, you answered it perfectly. So Jess is asking, in the missing variable report, there are numbers and brackets for some of the data elements. What do those mean?
Numbers and brackets.
Oh, I
Is
think
this
she
the
might be
slide?
talking about the footnotes. Go back. You had the right slide a second.
That one?
Yes. Up there where it says
Oh,
antibiotic discontinuation, and then you have a 3 in brackets. I think that's a footnote.
it probably is a footnote.
And it would be additional information at the bottom of the report that pertains to that particular variable. So Carol is asking if we can clarify that multi-procedural just means Proc ID 10. So multi-procedural is a composite that will contain Proc IDs 1 through 5, and then 9 and 10, or 7 through 10. So multi-procedural will be your cabbage composite, your aortic valve replacement plus cabbage, your mitral valve replacement and repair, mitral valve replacement and repair plus cabbage. And then it will include your multi-valve plus cabbage. Melinda, will you please show the webinar calendar again?
Yeah, I put it up for people to see.
You were quick.
I was reading ahead.
You were reading ahead. Thanks, Melinda. Great presentation. Appreciate your answers. Super helpful. And then, yes, just meant those, the brackets around the footnotes. And Michelle is right. The brackets are footnotes that refer to the isolated procedure requirements.
That's good. I need to know that.
All right. We don't have any more questions. Oh, yeah, we do. This one popped up. Jackie, this might have been covered prior, but I know in the past Carol has mentioned that after harvest close, that data goes into the analyzed reports and they won't be changed as far as star ratings at harvest close, etc. For auditing purposes only, we could go back and correct incorrect data.
Oh, I can take this one.
Okay.
Ooh, me. Uh, so Jackie, that's a great question. Once the harvest is closed and the analysis is run, star ratings are calculated for on harvest 1 and 3 data, those star ratings don't change. Going forward, though, you can go and update. I get this is probably saying it not quite correctly, but you can go and update that data if you notice an error, and then it will be reflected in future harvests and star ratings. So if you performed a case in December of 2024, and you caught an error in coding something as you're preparing for the harvest, we absolutely want you to go back and update the case, resubmit it, resubmit a file that includes that case, or do it within direct data entry if you're a direct data entry user, to update it within the warehouse. The updated data will be used in, we won't have it in the audit file, but we will have it in the future harvests. So the next harvest that includes that case, which would be harvest 2, or if you notice it for harvest 3, the updated data will be used in analysis and would be reflected in your analytical outcomes, risk adjusted rates and things. So
Yeah,
yes, if you
I think
ever find an error in your data, please go and correct it and make sure you update it to the IQVIA warehouse.
yeah, that's what I was going to say. Even if you when you correct it, make sure you resubmit it because we want it to be in the analytic database, not just in your vendor database.
And I'm gonna, yes, that's right. And I'm gonna mention this as well. I know Emily Conrad is on. We are preparing for the 2025 audit. Sites have not been notified of that yet. We're still working internally on it. But I will tell you this, whatever data was in the warehouse on December 31st of 2024, that is the data that will be used for your audit. So even if you go in and make updates now, you find errors now, whatever data we had in the warehouse on December 31st is what will be used. If there's a discrepancy in what's in there now compared to what was in there in December 31st, if you went in and updated something, we will not have that in the new, we will not have that in the file that we use for the audit. So just keep that in mind. We keep that in mind too. And we work with sites on those, but just for awareness purposes, the data that was in the warehouse on December 30, ending with December 31st OR dates is what's used for the analysis. For audit.
Thanks, Carol. All right. No more questions. Thanks everyone for joining. We really appreciate you attending these training webinars. I think they're very, very informative. Thanks, Melinda, for presenting today. Thanks for the STS staff for joining and helping with questions. And thanks to everyone. We appreciate all of you. All
See
right.
you next Tuesday at 12
Yes.
Central Time for the next session.
Yeah, we're going to be spending
Yeah.
we're going to be spending a lot of time together the next 2 weeks, I think.
Yeah, and the next session will definitely be a little bit longer than this session. There's a lot more information to cover. So we got done early this time, but I bet we'll take the whole hour and a half next week.
All right. Well, thanks everyone.
Good job. Thanks,
Thank
Nancy.
you.
Thanks, Melinda.
Thank you all.
All right, bye.
Bye.
Bye.